Direct from Foxborough, Massachusetts, the gem of Norfolk County, and taped at the studios of Foxborough Cable Access. It's Foxborough Central, and here's your host, Bob Hickey.
And welcome to another episode of Foxborough Central. I am Bob Hickey, I am your host, and I am very glad that you took the time to join with me and my guests as we talk about the people, events, and organizations that make Foxborough truly the gem of Norfolk County. Every once in a while, we go a little regional, and today's episode is no exception. We are going to venture far south to Mansfield, actually right across the Mansfield-Foxborough line. We're going to talk a little healthcare today. Now, healthcare is always in the news, double-digit increases in your insurance premiums, doctors who are doing double surgeries at the major hospitals. Seems to be a lack of attention in that personal care that we all like to think we remember at least. I remember my primary care physician growing up, Dr. Ronco. Dr. Ronco gave me allergy shots and gave me my annual physical, and I remember Dr. Ronco not having much time for the kid, but he always knew what was going on. So that was my guy. Who's our guy nowadays? Sometimes we don't even know. So I'm very honored to be joined by a couple of new friends, Doctors Wendy Cohen and David Cunningham. They are both physicians out of the Infinity Family Care practice in Mansfield at 450 Chauncey Street. That's 106, right across the street from the Stop and Shop. So enough about me talking. Let's talk to Wendy and David. Wendy, so nice of you to join us. Thank you.
Thank you for having us.
And David, thank you for taking the time.
Thanks for having us both.
So, Wendy, Infinity, I'm going to read it, Infinity Family Care. Why is this different than any of the other 10,472 doctors that have a practice set up in Foxborough?
Well, David and I have both been working in this area of Massachusetts for 20 years between us.
At least.
At various practices. And in 2015, we were at a practice together and really felt like we weren't able to provide the type of care that we wanted to be able to provide to our patients.
So when you say that, that's a little concerning, but at the same time, I think a lot of people share that, and that they get a sense as though they're either just a number or there's not enough time, because everything's so regimented as far as insurance will pay for 8 minutes of this. And I used to be a professional recruiter, and one of the major job categories would be billers and people who understood the whole billing system. And I had a set of questions, and I started to learn a little bit about it, and it got to be really interesting as far as interpreting and understanding. I cannot imagine how a private practice or a smaller practice can really keep up with all the insurance issues and changes. And so have we thrown that away? What are we doing?
Well, that's right. Even in that system, they were good people, but they were working to the incentives that existed for them. With direct primary care in our practice, we take insurance out of primary care and we work directly for our patients. With this, we're able to keep the practice smaller, have more time per patient, and really provide a more personalized, hassle-free experience.
David, it's interesting when she says that, because I have to believe that a lot of the insurance company reimbursement schemes are that you have to see X amount of patients and you can only spend so long with each one because you have to keep the ball moving forward. And from what Wendy is saying, it sounds as though by taking insurance out of it, it's a whole new dynamic in the office.
Absolutely. So what we feel together, and part of the direct primary care movement, is that we're not anti-insurance. It's really important to make sure that insurance is there as a safety net for people, for major illness, for accidents, for cancer treatment, for specialty visits, high-cost radiology, all the things that are quote-unquote insurable, things that are not necessarily expected in any given year or any given lifetime. Mm-hmm. But to use insurance for primary care doesn't make sense, because primary care is really something that should happen. It's something that we expect to happen. So to start insuring an expected event becomes very, very expensive. And so insurance in this situation becomes more of a bloated payment system. and not insurance. So what we've done is we've removed it from the relationship between the doctor and the patient so that we can provide that level of service, the time, the attention, and the honest relationship, partnering with our patients, without having to worry about what we're doing in terms of billing, coding, compliance, and all the collection issues that really take up so much of the time of doctors in the current status quo system. And then we can provide a very honest situation, a very honest experience for patients, and leave insurance for the things that we can't provide, whether it be surgery, whether it be MRIs, whether it be high-cost care of any form, whereas the things that we do shouldn't be expensive. And Infinity Family Care is Dr. Wendy Cohen, Dr. David Cunningham. We have Rachel Clay, who's our office manager, and Christine Dansereau, who's our medical assistant, and that's it. We really keep it nice and small so we can pass on those savings to our members.
Dr. Cunningham,
Yes, sir.
the Affordable Care Act makes health care insurance affordable to all Americans, and all Americans have to participate, or else the insurance system is not going to work, and insurance is going to be too expensive, and the healthcare system will fall under the weight of itself. True or false?
False, because what you have done is you've equated care with insurance, and the two are not the same thing. More and more, whether it be 2017, 2018, 2016, when we started, we are seeing this in a very significant way, that insurance does no longer equals care. So you can have insurance, whether affordable or not, and I'll let you be the judge, but that does not equal care. People are getting hit with enormous deductibles, and they're having, again, what really amounts to catastrophic care. But if you want to be seen by your primary care doctor to manage your diabetes, to take care of that sore elbow that you've had for 3 weeks, to talk about your insomnia and your anxiety, or just to work on getting healthier, dietary concerns, or maybe even just cancer prevention concerns, that costs a tremendous amount of money in the old system because patients are paying more and more of that. So in our model, we wipe all that away and we say it's either got to be redesigned or eliminated so that we can, again, work directly for the patients. And we have found that most of our patients, and I can't promise this for any individual patient, but on average, most of our patients are able to save money by choosing lower premium, higher deductible plans and paying for our services, knowing that the work that we do doesn't hit that deductible.
You know, it's really interesting you say that because, for anybody who works for a large corporation, for a robust insurance plan that has all these free or included benefits, there's nothing in this world for free. And that's the political piece of it that I don't think anybody really wants to address, is that there's no such thing as free, gym membership for $150 deductible. Well, you're paying for that insurance.
Absolutely.
And your employer, by the way, and here's the other dirty secret that I don't think people like to talk about, is that your salary includes the portion of your insurance that the employer is paying for, as well as the portion of your taxes that the employer is paying for. So, hey, I'm making $25,000 a year. Well, maybe the company is actually paying $38,000 for you, the employee. Well, that $38,000 isn't yours, unfortunately. You only get 25 of that. So there's that whole hidden piece that I think people kind of don't want to acknowledge, because if you do, it sort of makes you sad. My son is great. He just entered the workforce, and every time he says, well, I got paid X amount of money. I only got to keep this amount of money.
Oh, of course. It's a very, very tough lesson early on. But no, employees don't get that option. They don't. They're not told what your options are, and there's really very little transparency, which is one of the things that we are passionate about, is transparency. Patients know, members know how much they're paying per month. Everything's upfront on our website. There are no hidden costs. We don't nickel and dime. All the care that we can provide directly as full spectrum, well-trained primary care physicians is included in that monthly cost, whether it be minor procedures in the office, testing, EKGs, skin procedures, biopsies. Wendy's trained to do endometrial biopsies and IUD insertions, and has done fellowship training in women and children's health. So we run the full gamut, and all of that's included in what we charge. So not only do we think financially it makes sense, but we're also very proud of the value that we can bring to the healthcare equation.
So the issue here is not quote unquote real doctoring. This is a family practice like any other family practice. This is a matter of changing the paradigm about finance and compensation.
And we'd argue it's a lot of family doctors aren't practicing their full scope of training because of the limited time in the current system. They're referring out for things.
And there's no reward also, because if I spend the extra time with you and we talk about, you mentioned anxiety. If I see an issue with your back and we get into a discussion about anxiety, if I'm not able to bill for it, then where's my reward? And then I'm penalized for not moving you out in that 8.2 minutes or however long I'm allotted for the compensation rate that I'm receiving, which, by the way, is inflated because they're going to discount it. So it seems to be a constant ladder going up as far as creating the bubble, which leads to 10% increases every year in your insurance premiums, which is a whole nother discussion. But actually, it's not another discussion. This is our discussion. So I'm talking, and Wendy, I'm going to ask you about the website right now, and I'm going to mention the website to everybody at home. It is www.infinityfamilycare.com, exactly as it sounds, no spaces. Again, this is Infinity Family Care, and they are located at 450 Chauncey Street in Mansfield. It's on 106 across from the Stop and Shop. Their telephone number, if you want to reach out to, who's your office manager?
Rachel.
If you want to reach out to Rachel and see what's up at the Infinity Family Care, it's 508-339-2900, 339-2900. They are family physicians. The practice has been around for how many months, years?
We just completed 2 years in February.
Fantastic.
Yes.
Robust clientele?
Yes, we have nearly 600 members in our practice. We started with a little over 200 2 years ago.
Okay.
So the word has gotten out.
That's
and,
excellent growth.
Yeah, so a lot of people are finding us just because they're looking for this. A lot of people are finding it through word of mouth, and it's been very rewarding to grow like this.
So word of mouth is important because, particularly with doctors, we all go to somebody who and hairdressers, of course, somebody who is recommended and that we trust. And so by virtue of the fact that you've increased by 200% over the course of just 2 years, that's a pretty nice growth trend. Where do you see this type of family practice with the compensation model going? I understand you're going national with it.
We're part of a network more for support and education of other doctors who may be interested in moving into this type of practice, as well as patients who may or may not even know the option exists.
Sure.
By nature of the small personal practice, we're not going to grow indefinitely. That's what we did in the old system.
True.
But we aim to have around 400 patients per doctor.
Interesting. So there is a cap because there's only so much that one person can do.
Right. And most of our visits are 30 to 60 minutes. So we really feel that we will grow to the point that we can provide the personalized care that is the foundation of why we're doing this. And then we'll open another site and grow.
There you
add
go.
some
Maybe
new docs.
maybe bring in some more friendly doctors and do something more. So you mentioned the website when we were talking a little bit ahead of time. You said that all of the pricing, and you alluded that all the pricing is listed directly on the website.
Absolutely.
So no sticker shock, no surprises.
Yeah, and some people may be more familiar with concierge medicine, which was sort of, I feel like direct primary care kind of took the good things of that, but lowered the overhead so that we can be at a much more affordable price point. And if you're doing a Google search and you don't know if the practice is direct primary care or concierge, every direct primary care practice I know nationwide lists their prices on their website.
Okay. So this is a national movement of trying to create a different reality when it comes to affordable health care.
Yes.
And it doesn't have anything to do with the government, it doesn't have anything to do with the major insurance companies. It just has to do with some people who say, okay, enough is enough. We can provide better care. I want to do a better job doing what I do, and this is how I can be fairly compensated for it. Is that pretty much it in a nutshell?
And advocating for our patients. To
patients.
steal Ryan Newhoff's.
What an idea to talk about the patients. Good for you.
But the first do no harm, other great founders in this movement have said that also means no financial harm. In the old system, we would recommend a treatment or a test, and we could not tell the patient how much it was going to cost because every insurance was different, every site was different. Now we spend time developing relationships in the community, and once we get outside of the third-party reimbursement system, we're able to negotiate client billing for things like labs, x-rays. Other states, unfortunately, Massachusetts is one that limits this, but in 40 of the other states, direct primary care practices are allowed to dispense medications to their patients. So the physician owners purchase medications wholesale, and they can save their patients the entire cost of membership.
That's amazing.
Because
Yes.
we're so ingrained in this insurance model that we think that a $15 copay is, we're winning.
We're great.
That's great. But that medicine costs 63 cents. But nobody could get to that data before. But it's starting to come out, and it's starting to be publicized by some of these private direct primary care practices that are doing the wholesale medication costs.
Which is counter to what mainstream media and in particular, well, and also the national political scene is. It's all about controlling costs through absorption of smaller companies and creating mega insurance entities or nationalized healthcare. It's the polar opposite of what you're saying. Just eliminate the insurance from the standard care.
From the primary
Obviously
care space.
not, as you point out, cancer treatment is tremendously expensive, specialized medicine. Sometimes insurance, just like with cars and boats and houses, you want the insurance for the catastrophes, but for changing light bulbs, we don't have house insurance to pay for the light bulb, but I got to pay a copay for the light bulb.
Exactly.
And that's what I liken, getting your annual physical to.
Right.
It's free. That's awesome, but it's not free.
We have an analogy in the direct primary care movement that you do not use your car insurance to pay for gas, to change your tires or change your windshield wipers. If you did, your insurance would tell you where you could get gas, how much you would have to pay, and if you wanted to go out of town, you would need prior authorization. And yet we stand for that.
If I wanted to go to Exxon instead of Texaco, I'd have to get an out of
network.
gas station, out of network provider exemption.
Exactly. So,
And the person at the next tank would be paying something totally different.
But we tolerate this in medicine because it's happened so slowly. Over 30 to 40 years, insurance went from a very worthwhile, needed safety net, like we said before, almost a catastrophic care, to really taking over and controlling the entire relationship and dictating what is quote unquote quality. And this is, again, a whole nother conversation, not necessarily for today's show, but a lot of those quality metrics that your primary care physicians are paying attention to when they're supposed to be taking care of you and not treating the chart have been shown to be fairly useless over time. Not all of them, but the focus is on the wrong things in the doctor's office. We used to say that when we would go into the exam room, there would be three people. There would be the doctor, the patient, and the insurance salesman, or the insurance executive, not necessarily physically there, but their presence was certainly felt. Because so much of what we were doing in terms of documenting and billing was really about treating that chart so that we would get reimbursed properly.
Absolutely.
And so the incentives are not what does Bob need, it's what does Bob's insurance need. So getting that back to a good balance, and what you were saying before about this movement, it's really about taking control back to where the control needs to be. It's not about the patient's always right, it's not about the doctor's always right, it's about the doctor-patient relationship being at the center of everything we do. And if the things that we are doing at Infinity Family Care don't serve that doctor-patient relationship, then they either need to be tossed out or redesigned, or we need to rethink these things. So I would welcome any of your watchers to come visit us. We do offer no obligation meet and greet visits at our office. And I think from the moment you walk in the door, they will see that it's a very different experience, that we do not feel like a doctor's office. We do not want to seem like your typical sterile, white, high volume, large waiting room doctor's office. It's a much more personalized experience because it's all about creating that space of safety and partnership. So it's really,
It's really
it's
interesting.
been fantastic.
And clearly you are passionate about what you're doing. You're speaking from a me standpoint, which is very cool, and it shows that you're invested in this movement. So this is your practice,
Yes.
your partners,
Yes.
We are.
and the next step would be to not only get full for the physicians you have here, but sharing the message. Now, you mentioned that Massachusetts is one of the states that does not allow for physician distributed medication. Is there any legislation on in the works, or is there any advocacy that maybe some of the folks at home might be able to learn up on and participate in, or?
We're starting. I testified at the Mass Medical Society annual meeting in December, and they actually adopted the resolution that I
Really?
testified for,
They
which
didn't
was
boo you off
in
the stage
favor of. They didn't.
for trying to
No.
usurp the
We had two
big
DPC.
insurance companies?
No,
No?
2 DPC resolutions,
Excellent.
and we got both of them. So we have
So
that
it sounds
support.
as though there's support for this movement.
I really think there is.
Because I would have to think that most people who become doctors do not do it for the express purpose of satisfying insurance company regulations and billing requirements. I would have to think that most people get into the field because they care about people and they want to treat and they enjoy the science behind it and they like the interaction and they have that investigative piece that wants to dig deep and find out what's wrong and how to fix it.
Yeah, we love this model because it allows us to get back to just that. It allows us to feel like healers again and really get down to the root cause of illness and not just put Band-Aids on things, figuratively and literally, and send them out the door in those 7 to 8 minutes just for them to come back with the same issue 3 months from now. The problem is that before you know it, you'll turn around and it has happened to healthcare. This insurance-driven mandate to see patient after patient, really has to do more, right? We say that the medicine has become too transactional, that we were reimbursed in the old system by doing things, by creating a visit for you, by conducting a physical exam, by doing a procedure, by ordering a test, by prescribing a medication, whereas none of that has to do necessarily with Bob.
Right.
So now our incentive is to take care of Bob. And whether that's in the office, or whether that's on the phone, or whether through a virtual visit, which we do, we have patients throughout the Commonwealth who have known us, many of them have known us for years and may have moved either other parts of the state or even out of state,
Really?
who still maintain their relationship with us because we can do so much without having to bring them in and bill their insurance and collect a copay. There's no obligation to do that
Isn't that
anymore.
the highest compliment when somebody leaves and yet they stay?
Yeah,
That's great.
Those relationships are really, really special.
We are so close to running out of time. Of course, you get the last word. I'm joined here by doctors Wendy Cohen and David Cunningham with the Infinity Family Care practice here at 450 Chauncey Street in Mansfield. The telephone number is 508-339-2900. And of course, they've been very nice to come and share with us about the movement to go to, I guess it's called the grassroots organization, client primary care. Direct primary care.
Yes.
So it's a movement that's starting local. I guess everything is local, but it sounds like it's spreading. It sounds like some of the physicians in Massachusetts are recognizing that there might be some value in this, and it's something at least to explore. And maybe our legislators will jump on board and help promote some legislation to maybe loosen up the controls that the pharmaceuticals and the insurance companies have to allow for some alternate. It's not even alternate medicine. It's standardized. It's standard care. It's alternate funding.
Yes.
Which is a whole nother, probably a harder dragon to slay actually, because it is all about the money sometimes, and you can want to do the best service, and unfortunately, if the compensation isn't there, we all have to make a living.
Well, I appreciate you having us here because I think the hardest thing about this initially is educating people that this is an option, that there are alternatives to the typical big box medical practice, and that we can provide a fantastic experience.
Awesome. And Wendy, you get the last word.
The last word.
The last word.
Yeah, so I would just encourage anyone who's interested to call us up, send us an email, set up a meet and greet. We get a lot of people saying, it can't really be that easy. It can't really, where's the catch? Because we're so ingrained in the complicated, opaque, I can't talk to the doctor's system.
I have to call my insurance company, find out if you're in network, look it up on the website.
Your receptionist blocks me.
Right.
It really is that simple.
Get an appointment 4 months from now.
Exactly. Go see urgent care.
That's right.
Yeah.
Not here.
No.
Not here.
We have no mid-levels that we see our own patients. We take call for our own patients 24/7 because we feel that being able to reach the doctor who knows you when you're in a crisis is one of the most important values we can provide.
Dr. Wendy Cohen, Dr. David Cunningham with Infinity Family Care, thank you so much for coming out and sharing your story, your passion, and this new approach towards family practicing. It's really interesting, and I wish you all the success. And hopefully folks here in Foxborough and Mansfield, if you're looking for a different approach or you're looking for just someone who can maybe provide some affordable and caring health care without having to jump through all the insurance hoops, the Infinity Family Care Group might be the ones for you. Check them out at www.infinityfamilycare.com. Call them at 508-339-2900. Thank you so much for coming out, and thank you very much for sharing the last half hour with us here on Foxborough Central. Your Foxborough Cable Access is made up of volunteers, and if you'd like to come volunteer with us, like I do, come on down, check us out. We're at 28 Central Street here in beautiful downtown Foxborough, Massachusetts. You can also stop by, see Mark Nash at the front desk, and learn how Michael Weber and his team of volunteers make for a wonderful experience here in Foxborough. We are out of time, but we're never too short on time to say goodbye to my friends. Have a great one, Foxborough.